Amit sir, please start with the introduction.
Good morning, all dear participants. We have the one more resource person for today's lecture titled "Crack the Code: Understand Advantage in Management and Repeat Breeding in Dairy Animals." So, before the starting the presentation, I would like to introduce the resource person for today's lecture, Dr. Govind Nayan Freud. Sir is presently working in the professor and head in veterinary clinical complex, the Tati Veterinary College, Sri Ganganagar, Rajasthan. Sir has also served for the Dean PGS, Rajwas Bikaner, and the head of Department of Veterinary Gynecology and Obstetrics. So, sir has the good academic record from the schooling and college as well. And after sir has started his service as assistant professor in Life Research Station, Vallabhnagar, Udaipur, and then uh, professor at Department of Associate Professor and Professor at the Department of Veterinary Gynecology and Obstetrics, Bikaner. Sir has handled 6 projects in which uh, sir has worked as scientist in 4 projects and as a PI, principal investigator, in 2 projects. Sir is well recognized for the uh, key person or important person for the Rajasthan state first embryo transfer in calf and transfer calf and lamb, and received the appreciation from the former chief minister of Rajasthan. Sir has published the 9 books, in which there are 2 international books, and in one book, sir has the single the Asian editor of the that book. Sir has published 245 publications and guided the 25 embassy and 6 PhD students. There is also experience of the extension services by working in the cooperative dairy sector also. And sir has achieved the 2 important awards. The one is the Niels Langrof Memorial Award and GB Pant Memorial. Sir has also achieved or gained the Lifetime Achievement Award from the Pasudan Paris and the fellow elected from the NAS New Delhi. Apart from these achievements, there is the vast experience of the 35 years of vast experience of teaching and research. And recently, sir has launched his own YouTube channel, and at there, sir has uploaded 606 video lectures of DVSC standard from the for the gynecology, obstetrics, and endology courses. And sir has also uploaded the Hindi lectures for the farmers also. So before the starting the this lecture, I would like to welcome Dr. Professor on the behalf of all the participants and the organizing secretary of this 21 days national refresher course on the current development in veterinary and fisheries science, jointly organized by the Rajwas, PUFOS, and NADCL. Sir, good morning, sir.
Thank you, Dr. Amit. Thank you, the organizers, for inviting me to interact with you all. It has always been a great pleasure to interact with you people, and I have been gaining much from the students, especially for my YouTube channel. I gained much momentum from the students. So thank you very much for inviting me to this innovative online learning. And I would like to thank the organizers for providing me this opportunity to interact with you all. Thank you so much.
Yes, sir. I would like to, sir, request for starting this presentation, sir.
Okay.
Yes, sir.
So, good morning, everyone, and welcome to this session and welcome to this lecture on recent advances in repeat breeding management in dairy animals, right? Now, repeat breeding, as you all know, is a burning problem, and it's a major reproductive disorder, especially in the urban areas. And so in our today's talk, I'll be briefly talking about here are the contents on which I will be talking today. I hope they will be useful to you. So our today's talk includes these contents: understanding repeat breeding, then the second topic, recent advances in management techniques, and the third, practical applications and future directions. Right. So am I audible?
Yes, sir.
Am I
Yes, sir.
audible?
Yes, sir.
Okay. So first of all, we talk what is repeat breeding. As you all know about it, that what is repeat breeding, I need not to stress on that. But briefly, failure to conceive after 3 or more inseminations without clinical abnormality. That is basically a repeat breeding. And the causes, you all know, have been classified in a number of ways. And the major classification includes the failure of fertilization and the early embryonic deaths. Many publications have stressed that early embryonic deaths are a major reason for the repeat breeding. And I have classified this repeat breeding as because of the male, the semen factors, and because of the female, and because of human factors, right? So repeat breeding is a major reproductive challenge with incidence ranging from 6 to 35% in different dairy organizations. Now, it's a manifestation by the animal due to multifactorial etiology, and in fact, when we read gynecology, uh, we usually discuss repeat breeding at the end because all of those conditions can result into all or many of those can result into repeat breeding. It's a global problem, and modern day high producing Holstein cows, due to intensive selection for high yields, have reduced fertility. This was exhaustively reviewed by Dobson and his co-workers in 2007, and many reports thereafter. They also stressed that Holstein cows have been selected for production and production and production, and ultimately the reproduction has gone down. Now they are shifting to three horizons: not only production but also disease resistance and high reproduction. So let us see if the positive results will come in near future. But as of today, the problem remains. It is more common in cattle as compared to buffaloes because buffaloes probably have a smaller breeding season. The predisposing factors could be negative energy balance, high protein. You see, high protein feeding. It's very usual for the farmer to feed high protein for enhanced milk production. But when he feeds the animals with very high protein, it changes the uterine pH and decreases the plasma progesterone. There is more release of ammonia, and the blood urea nitrogen raises. And these ultimately affect the follicle development and uh, uh, ultimately results into repeat breeding. Then micronutrients, deficiency of the micronutrients, or one more important factor that was stressed in many reports was the supravasal progesterone. You see, supravasal progesterone is the high progesterone on the day of estrus. Where from it comes? On the day of estrus, where from progesterone comes? It arises from the adrenals, conversion of the androgen to progesterone. That can affect the fertility. And this is basically because of this supravasal progesterone basically arises because of high stress. And then infection or reproductive tract abnormality, poor semen quality, the age of the animal, the genetics, and then the periparturient disease and stress appears to be very, very important. Now, many reports have mentioned about the immunologic or anti-sperm antibody that can be released. But I think this is more of human concern because you simply change the semen and you get rid of immunologic anti-sperm antibody. Then there could be physiological factors referred to the internal biological processes and conditions in animals that affect the reproductive cycles, such as hormonal imbalances or health issues, environmental influences, and management practices. Management practices include the strategies employed by the farmers and breeders, such as breeding techniques, healthcare protocols, and animal handling that either mitigate or exacerbate repeat breeding issues, right? Now, many reports, I have mentioned a few of them, have analyzed and critically said that these are the major, in percentage basis, these are the major causes of repeat breeding in dairy cattle. The hormonal, the infection, the nutritional, and the error in artificial inseminations. A meta-analysis on pregnancy losses, Albaz and his associates in 2023, they mentioned that the average pregnancy loss rates were 10 to 20% during the early embryonic period, day 0 to 24, 6 to 8% in the late embryonic period, 25 to 45, and 2 to 4% during fetal stages. Now, many reports previously have also, like Ginther and many other workers have mentioned that the 8 to 15-day period, that is most crucial, and most embryonic deaths occur during this period, either because of the non-conducive environment in the uterus or because of the low luteal progesterone. Heat stress could be the major reason for repeat breeding in dairy cows during the summer season, and then uterine inflammation and inadequate luteal function. So emphasis must be placed on early diagnosis, luteal support, and stress management during early pregnancy to minimize the repeat breeding due to embryonic loss. This was stressed in this meta-analysis by Albaz and his associates in 2023, right? Now, from a clinical perspective, I have put the clinical perspective. Most clinicians would not be interested in the bookish knowledge. So I have put it as a clinician. As a clinician, the most important reason, as per my analysis, could be clinical or subclinical uterine infection. And this is one of the biggest cause of fertility. Poor parturient hygiene. Farmers often do not care about the parturient hygiene. Cows are living in a unhealthy or a very filthy environment, and so the infection persists. Then ovulation insemination mismatch. Farmers are bringing their cows for insemination, and the inseminator is directly inseminating. At many places, vets are not available, so inseminators are performing the insemination, and they inseminate without any prior knowledge. So there is a ovulation insemination mismatch, then improper estrus detection. And one more problem with the Holstein Friesian cows, current day Holstein Friesian cows, is they have a very longer estrus period, 3 days, 4 days, 2 days. And so the inseminator will inseminate on the first day, but the cow remains in estrus for another 2 days. So there is an insemination ovulation mismatch. The sperms would remain viable for 24 hours in the female reproductive tract, and more recent studies have stressed that cryopreserved sperm will not remain viable for 24 hours in the female reproductive tract. They say it's only 12 hours. Maybe if with natural mating, the semen may remain, the spermatozoa may remain viable for 24 hours. But with cryopreserved semen, which is widely used, that will remain viable for a shorter period as well. So that results into insemination ovulation mismatch, and then improper semen. A very common practice of inseminating cattle is putting a straw in your pocket and taking it to the farmer's door. That I strongly condemn, because some studies carried out at Rajuas, they have pointed out that 15 minutes after thawing of the semen, every 2 minutes, the fertility goes down. So I strongly suggest that this should be avoided. Then improper CL development, heat and oxidative or other stress, and especially with indigenous cattle, the CL evaluation is again a difficulty, because the CL is very small. It is not projecting out of the ovarian surface. It is not button-like, just like a classical CL. And then heat and oxidative deficiency or excess of nutrients, poorly identified factors. Yes, we do not know why the CL is not properly developed. There are some factors which we do not know, right? Now, what will be the economic impact of repeat breeding? On a herd basis, the loss to the farmer when an animal repeats thrice can range from rupees 16,500 to 33,000 because of loss of 2 months or maybe 3 months of production. And the long-term effects on productivity will be the overall productivity of the herd decreases and the production costs increase, right? Now we come to the diagnosis. The conventional diagnostics have been record analysis, the visual inspection, and the transrectal palpation and vaginoscopy. Actually, with transrectal palpation, you can identify the abnormalities. But for a repeat, especially the ovarian cyst, the use or the particular benefit of transrectal palpation for a repeat breeder cow appears to be limited because you can know the uterine tone at the time of insemination, but it's a subjective matter because different palpators may feel the tone as differently. And palpating at the follicle at the time of insemination, I don't suggest because sometimes you may rupture the follicle unnecessarily. Then one thing which clinicians can follow is ovulation depression, whether ovulation has occurred or not. Holstein Friesian cows might be having estrus for 2 days, 3 days. So what they can do? They can palpate the same animal every 12 to 24 hours and see when a ovulation depression is palpable on the ovarian surface. But sometimes this is also not possible, especially with the indigenous cows where you find the ovaries are very small and it's really very difficult to identify by transrectal palpation the ovulation depression in these animals. Then early CL is very small and palpable findings are suboptimal, and detecting early embryonic deaths by transrectal palpation, it's not possible because most embryonic deaths occur before day 20 when you are not able to surely say anything. Then tests like uterine pH or the white side test, cytology. More recently, there has been development of the evaluation of the uterine cytology. But again, that depends on how many days the animal has parturited and so on and so forth. Now, there have been some advancement, I can say, ultrasonography and Doppler imaging. MRI and CT imaging prototypes are under development, and hopefully we will have some probes, just like a ultrasound probe for MRI of the entire area, and contrast sonography for judging the tubal patency, and then hormone assays. But practically, hormone assays are not possible at the field level, especially the progesterone assays using ELISA or RIA. And uterine cytology, I think, will be in times to come, will be available to every clinician. You can perform it with ease and you can evaluate it. Then ultrasonography can be helpful in particularly in detecting some things, some abnormalities in a repeat breeder cow. You see, classical texts that they mention that ovarian cysts are of two types, follicular and luteal, and cows with a follicular cyst will be nymphomaniac, and cows with luteal cyst will be anestrus. But you nowhere in any text it has been mentioned that repeat breeder cows with normal estrus cycle may also have ovarian cysts. So it's important for us to understand a repeat breeder cow may have a ovarian cyst. So these are the ultrasound picture which can help you identify some pathologies like uterine fluid accumulation, mucometra, follicular ovarian cyst, or luteal ovarian cyst. Then color Doppler determines the echogenicity and blood flow, and hence can determine physiological status of follicles, CL. But this again is in the developmental stage. We have conducted some studies which show the blood flow to the CL using in Rajuvas, and then the color Doppler assays of different stages of gestation also. But these data are in the developing stage, hopefully in times to come, we will have authentic data which we can use for determining the blood flow to the CL or physiological status of the follicles. As I said earlier, magnetic resonance imaging, prototypes for transrectal imaging are under development, and hopefully we will have three-dimensional images using these prototypes. But currently, we are not able to use either MRI or CT scans for the evaluation of the pelvis of the animal, including the evaluation of the uterus and the ovaries. Then hysteroscopy could be a good approach to visualize the internal structures of the uterus. But a problem with hysteroscopy, especially for cattle, is the cervix of the cow. The cervix of the cow has cervical annular rings, and it does not allow easy passage of the any of the rigid or the flexible scopes inside the uterine lumen. Yes, hysteroscopy has gained momentum in equine species where they are using it for uterine evaluation as a routine process at many locations. But because the equine cervix is soft, friable, you can just dilate it by putting your finger inside. So you can easily pass the flexible scope or maybe the rigid scope as well inside the equine uterus. But for bovine, it's really not possible. I don't know whether in times to come we will have some mechanism by which we can dilate the annular rings of the cervix and introduce the scope inside. But as of today, it's really very difficult to introduce the scope inside. So that is a limiting factor. And these are some of the pictures showing, you can see in this picture, there is some fluid and bubbles in the uterus. In this one, you can see there are hemorrhages inside the uterine lumen. And this is a normal uterine endometrium, you can see, taken by the endoscopes. Then tubal patency testing. Sometimes in some animals, you may require tubal patency testing. And we introduce phenol sulfophenolphthalein, and the urine color changes within 30 to 45 minutes of the dye in the uterine horn by using a catheter. A recent study found 44 of the 50 cows evaluated to have some degree of oviductal obstruction. But this was a very small study, so we cannot say like that majority of cows have the oviductal obstruction unless we have a very large study. Then contrast sonography, hopefully this will be available in times to come, and we can evaluate the oviductal patency by using these techniques. So this is a figure showing how the tubal patency testing using the ESP dye is being done. Then hormone assays, the progesterone assay especially could be useful for evaluating the functionality of the CL. For camels in many countries, there are laboratories that routinely perform the progesterone assay at very significantly lower price. But as of today, progesterone assay is very costly, and hopefully we can see in times to come, we will have some immunochromatographic assays available as a plate, as it is available for some disease diagnosis. Now, this is extracted from the reports that ultrasound is the procedure diagnostic tool which has been adopted very widely, followed by PCR and ELISA and uterine cytology. But in future assays, you will find that uterine cytology will increase as compared to ELISA or PCR. Now, what are the recent advances in management techniques? Let us discuss them. Now, keep it in mind that diagnosis of a herd problem is possible. You can identify, sometimes you can identify the cause of repeat breeding. But finding out the cause of repeat breeding in an individual animal is extremely difficult, whenever you are trying to evaluate for repeat breeding, first evaluate the semen you are using, and then evaluate the cows for anatomic defects, evaluate for nutrition and management and advise appropriate measures of correction, evaluate reproductive hygiene and insemination procedures, and adopt corrective measures if there are some faults in your procedures. Now, the clinician is often faced with an individual animal. So now we are shifting to the individual animal. Individual animal, I would say that poor parturient hygiene is one of the biggest cause that ultimately leads to persistence of subclinical uterine infection. So we will discuss later, but that is one of the biggest cause based on whatever clinical work I have done so far. And the recent approaches include the for genital tract infection, the older ones, the use of prostaglandins, the use of immunomodulators, ester glycogen, lipopolysaccharides, intrauterine infusion of autologous or heterologous serum. This you can try because serum contains opsonins, which can help in combating any infection in the uterus. So you can just draw some blood from the autologous or heterologous. You can draw it from the same cow, separate out the serum, heat and activate it, and then you can infuse that serum into the uterus. Then there are agents to alter uterine environment. For example, antioxidants, 4 millimolar taurine plus 50 millimolar fructose in PPS before AI. And then one good approach could be infusion of vitamin C. For example, Ascovet 20 ml before AI. This will help two ways. It will change the uterine pH. If it is alkaline, it will neutralize it. And then it is a potent antioxidant as well. So the use of antioxidants will be very helpful. And enzymes like trypsin, chymotrypsin, papain infused intrauterine, or the acetylcysteine, which is currently not available for veterinary use, but we can use the human one, 600 milligram in 50 ml of distilled water intrauterine. Then uterine motility stimulants like mifepristone or the clitoral massage after insemination can help in the therapy. Then next comes the use of hormonal treatments. One should always be cautious while using the hormone treatments, and first try the therapy using the conventional treatments, or first try to use antioxidants. And if it doesn't work, or if the animal is having ovarian cyst, one can use the GnRH or maybe HCG, or even the synchronization protocols can be tried. Now, for ovarian dysfunction, delayed ovulation, which is a common practice, especially with the Holstein-Friesian cows, one can go for GnRH, or maybe they use the HCG. One can use the human HCG as well. If sometimes the veterinary is not available, you can use the human one. Then less common non-hormonal approaches include the antiprolactin, because high-producing cows, because of high production and high prolactin, the LH surge is affected. So one can, for 2 days, you can give the cow bromocriptine 10 milligram orally, 12 hours before AI and at the time of AI. Then LH is again a energy-dependent hormone. So one can try administration of dextrose 500 ml intravenous at the time of examination, plus bovine insulin 0.2 international units per kg intravenously. Then the mixed estrogen blocker or estrogen stimulator, the clomiphene citrate, 300 milligram orally, or even the insulin sensitizer, metformin, 2000 to 4000 milligram can be used orally. So all these things will help in correction of the ovarian dysfunction. Then ovarian cyst, you know about the ovarian cyst and single intramuscular injection of progesterone, vaginal progesterone implants, ovsync protocols, the use of GnRH followed by prostaglandin, or the use of SCG followed by prostaglandin, or the transvaginal ultrasound guided aspiration. But transvaginal ultrasound guided aspiration can help resolve the cyst at once, but after some time again the cyst will reform. You see, the problem with ovarian cyst is not the therapy, but it is the reformation of the cyst which is a problem. And again, another problem is long-term persistence of a cyst on a ovary in a cow will result into changes in the uterus that will hamper the fertility, right? And one such sequelae of long-term case of ovarian cyst is mucometra. The animal appears to be normal, everything appears to be normal, and you inseminate it. There is a huge voluminous mucus coming out. Sometimes the huge voluminous mucus accumulated inside one of the uterine horn may even confuse you with pregnancy, right? So one must be cautious about it. And for mucometra, you can try potassium iodide, 10 to 15 grams daily with feed or for 5 to 7 days. Even for ovarian cysts, you can try potassium iodide. And then it has been mentioned in some reports that ovarian cysts possibly develop because of a thyroid dysfunction. So iodine injections or even altroxin tablets have been suggested. Now, another major reason could be luteal insufficiency. The CL is not developing properly. It is not producing progesterone properly. This leads to early embryonic deaths. So this can be improved by SCG injection at 4 to 8 days after AI, progesterone injection 500 milligram, but only after day 5. It is a routine practice by many the involved in veterinary therapies that they inject a progesterone at the time of AI. This is strongly condemned. I strongly condemn injection of progesterone at the time of insemination. If you want to use it, you use it at day 5 or thereafter. Then recombinant bovine somatotropin, but it's really difficult to get the somatotropin. Anti-estrogens like tamoxifen citrate. We had some trials of tamoxifen citrate for use in reducing the vulvar edema, but we didn't have any trials, so I have put a question mark here whether this would be useful or it will not be useful. Then GnRH at AI, and they again repeated at day 14 to 16, or some recommend at day 8 to 10, because at that time the second follicular wave starts and the dominant follicle of the second follicular wave will be available at that time. Then using bovine insulin on day 8, 9, and 10 of estrus has been suggested. And then letrozole. Letrozole, some recent reports have recommended the use of letrozole for luteal insufficiency and for ovulation induction as well. Administered 1 milligram per kg in oil on day 3 of ovulation. Some even suggest letrozole for ovulation induction at the same dose rate. And then feeding of fish oil or linseed oil. Fish oil contains docosahexaenoic acid, and that will prevent the release of prostaglandin, leading to repeat breeding. Then timing of AI and semen deposition appears to be very important. And if cows are having very long, lengthy estrus periods, 2 days, 3 days, then if you don't have anything else, you can go in for multiple AI, inseminate the cow every 12 to 24 hours. Then training of AI personnel. This appears to be very important because some AI personnel, they are not having sufficient knowledge, and this leads to failure of pregnancy. Many reports, they suggest deep intrauterine artificial insemination for improving the fertility. And then avoiding periparturient disorders. Actually, avoiding these disorders it will not be possible, given that high-producing cows may develop some or other of the metabolic disorders until unless they are having very precise care, precise management, and precise care. Then, as I said earlier, immunoinfertility is anecdotal, and you simply change the bull or change the semen straw, and immunoinfertility will be gone. Yet they suggest administration of vitamin C, E, and dexamethasone. Then management of dry cows is very important. In a herd, the dry cows should be managed very efficiently. Advise not to feed more than 10% of rumen degradable proteins. And then dry cows should be fed low energy, high fiber diet with more of chopped stock. And then many commercial preparations are now available. Feeding of anionic salts with calcium and phosphorus, because the dietary cation anion ratio will affect the development of metabolic disorders during the periparturient period. Injections of vitamin A, E, and C are very helpful. One can try even if nothing is available, or if you find that the discharge is clear, animal is returning to estrus every 21 days, there does not appear to be any fault with the ovaries, no ovarian cyst. The first thing I would suggest is administration of the antioxidants, especially vitamin E and vitamin C. 3 injections of vitamin E every alternate day, or maybe vitamin A and E and vitamin C intrauterine. That can help to a great extent. Then there were Nani in 20 and his associates in 2024 suggested like that vaginal probiotics, products like ProPreg are specially formulated for cattle. They contain beneficial bacterial strains such as lactobacillus and bifidobacterium, which are naturally found in the reproductive tract of healthy cows. Vaginal probiotics administered postpartum help maintain the genital tract health. So one can try these types of things. Right now, they are not available at many locations in India, but hopefully they will be available very shortly for use in dairy cows. So this is a summary. Repeat breeder cow or buffalo exclude the effects of season, especially if you are dealing with buffaloes and you want that your buffalo should become pregnant even during the summer months. You see, buffalo is an animal which responds favorably well to improved managemental practices. And I give you an example that when I was posted at LRS Vallamnagar at the buffalo farm, we had some things very good at that farm. All the buffaloes were allowed to wallow during the daytime, and just all around the wallowing space, there were big trees that provided shade, and buffaloes were showered before milking every day. So we had some 4 or 5 inseminations even during the months of May, June. So improving the management of the buffalo, they were provided lush green all the year. So for the buffalo, for the farmer, what you can advise to shower at least 1 bucket of water on the buffalo skin, because buffaloes have a thick, dark skin and very few sweat glands. So you can ask the farmer, you can ask him if green fodder is not available, you ask him to feed mineral mixtures, and that will help. Then for cattle, if you are dealing with a herd or if you are dealing with an individual, if you are dealing with a herd, first investigate the male, evaluate semen and AI techniques. Then if it is natural mating, then check for infectious diseases like trichomoniasis or campylobacteriasis, evaluate the semen of the bull, evaluate the age of the bull. If the bull is very aged, maybe fertility may decline. And for the females, you can evaluate the nutrition, collect samples for investigation of infectious disease, reduce stress if it is existent, and conduct the metabolic profiles. But for individual animal, which is faced by the clinician in the field, we generally deal with the individual animals, and only very few have opportunities to deal with the herds. Investigate for abnormalities of the genital organs like ovarian adhesion, cystic ovaries, tumors, stenosis, etc. Investigate for subclinical endometritis. When no tests are possible, treat on the presumption if there is a history of periparturient disease. Then monitor ovulations, estrocycle length, provide ovulation induction treatments, and AI, repeat AI, consider intrauterine AI. If animals do not settle, treat for luteal insufficiency, supplement with vitamins A, E, and C, and calcium, phosphorus, and selenium. Conduct PSP dye if the animal is doubtful and it appears to be repeat breeding after a long time. Then uh, conduct the PSP dye. Then cytogenetic karyotyping is not possible at most locations, right? So this way you can deal with the repeat breeder. Now, what are the practical applications and what are the future directions? Coming to the third point, uh, selecting cows with high fertility and high production and high disease resistance. This is what they are doing at many locations. Selecting the cows with high fertility, high production, and high disease resistance. Then DNA analysis can help determine high fertility traits that are probably declining due to intensive selection. And hopefully we will have the corrected animals in future. Then innovative technologies like monitoring and data analysis tools enable farmers to track the approaches that work. Using automated estrus detection techniques, timed insemination, use of encapsulated sperm can all improve the overall fertility of the herd if the farmer is holding a big herd. Then workshops and training programs for farmers and AI workers, developing guidelines for best practices for optimum fertility. This is required that we should develop some guidelines for best practices for optimum fertility. So here's my conclusion. Repeat breeding is complex but manageable. Advanced diagnostics and integrated management improve the outcomes. Inseminators kindly evaluate semen before looking for a problem in the cow. You first evaluate the semen which you are using. When herds have this problem, evaluate the bull, look for an infectious disease, and evaluate the nutrition and management. This is my final conclusion. So here are some of the references which you can refer. Thank you very much for your patient listening. You can find my lectures at ResearchGate, Academia, and you can find also all my lectures at the at my app, the GNP Sir Classes app. You can find all my lectures, one and all, in that app for free. We don't charge anything. You can find me at Instagram at the rate PurohitGN, and then you can find me at my YouTube channels, GNP Sir. And then we have started a new YouTube channel for veterinary students, GNP Sir Classes Official. Here we are posting lectures for all veterinary subjects, starting from anatomy to gynecology. We are posting video lectures for covering the entire syllabus for the PVSC students. We are also posting some the shorts for the aspirants preparing for the JRF in the GNP Sir Classes Official, and the aspirants preparing for the veterinary officer examinations. We are posting the shorts at GNP Sir. You can find them at GNP Sir, at GNP Sir Classes Official as per your requirement. Kindly like, share, and subscribe to these channels and provide us your comments so that we can improve further and we can bring something more useful for you all. Thank you very much. Have a nice time, and thank you again for providing me with these opportunities. If there are any queries, any questions, you are welcome.
Okay, sir. I think there is no query from any participant, sir. So thank you for delivering, sir, such a insightful information, sir. Your presentation was truly informative and valuable, sir. Thank you for being us and sharing your valuable time with us, sir. Thank you. Thank you once again, sir.
Thank you, Dr. Amit. Thank you, the organizers, for providing me with this opportunity, and thanks to all the participants for being with us. Thank you. Have a nice time. Bye-bye.
Thank you. Thanks.